Welcome to Community Chat. My name is Kevin Tachi, and joining us today for this special program, he is the chairman of the Abington Board of Health, Chris Schultz. Chris, welcome back to the program.
Thank you, Kevin. It's good to see you virtually.
Virtually. As you see, I'm wearing my virtual outfit.
Yeah, I decided not to dress up.
It's okay. It's all well and good. I thought I would give you an opportunity. It's that time of year. Here we are. We're cruising into the fall. Thought we could touch upon a couple of important topics that I know that was discussed at a recent board meeting. First, foremost, and I think it's important, a COVID-19 update. What do you have as far as COVID-19 when it comes to the town?
So far, Abington continues to do really well. It's a real credit to the businesses in Abington and the residents that everybody, for the most part, has been doing the right thing. I'm happy to report as of this moment, we're back in the green again. Last I checked with our health director, we had 4 active cases. There were a few people and businesses that were fined for mask violations. So we just continue to ask people to do their collective best to wear their masks and to continue to report any violations to our office, and we'll do our best to investigate them. This isn't exactly COVID related, but it plays in. Apparently, some people have been dumping mattresses around town. And we're asking that they stop doing that because we have to take extra precautions with them and clean them due to COVID-19 guidelines. We do take them. I think there's a $20 fee at the compost site. And honestly, if you need to get rid of a mattress and you can't afford that, call the health department and we'll try to work something out with you.
When it comes to getting your COVID-19 information, how often is that updated? How often does Marty Golightly, your health agent, receive that information?
I think there are generally daily updates from Massachusetts DPH. I know there's a couple of teleconferences that are held during the week. And then our numbers, which we report on the website, that's from Maven automated tracking service. And we get that weekly. So that's usually updated on Mondays. And then, of course, if there's a new case or something, we're notified, or he's notified right away.
School has started, knowing that it's getting colder. A lot of people are going to go from spending their time and having activities outdoors to being indoors. There's this, not if, but when we may see a second wave. What are your thoughts as a member of the Board of Health and what you're watching collectively with your members in regards to COVID-19?
It's difficult. I think everybody is just completely tapped out at this point. But despite the contradictory information we're getting, there doesn't seem to be a good possibility of a vaccine until maybe January, February at the earliest. And how successful that is entirely dependent on how many people take it. Our challenge going forward as we get into this colder weather is events are going to move indoors. And I think we're seeing consistently that the virus is spread by indoors, poor ventilation, face-to-face. So it's going to be a challenge. What I'm hopeful of is I believe in Europe, they've actually in their flu season already, and they're reporting lower numbers because people are wearing masks. So maybe we won't get hit with as bad of a double whammy. We can always be hopeful.
That's a fantastic segue, because I know that there's been talk about a flu clinic that the town is going to have. What do you have for information about that? And could you kind of talk to the importance of getting a flu shot?
We're in a difficult situation with the flu clinics. I know our Marty and our registered nurse in the health department have both been working very, very hard to put together flu clinics and to offer pediatric shots, which is not something that we've offered in the past. The idea behind this, and this was planned well before the state mandate, was just to prevent overwhelming doctors' offices and pharmacies, give you a local place to come. That is still on track. The difficulty we're having is because the state mandated flu shots, doctors' offices and pharmacies have overstocked, which makes it very difficult for us to get our hands on vaccines. So as of the moment, we haven't been able to get them, but we're still on track to have a couple of clinics probably mid-October.
Okay. And as you get that information, we'll share that information on our bulletin board as you get it. I'm sure you'll distribute that as you normally do in and around, whether it's social media or at town hall, correct?
Correct, yeah. And yeah, we'll get the word out as soon as we know. I think if we actually have dates and times, we'll probably try to get that out on Nixle and Constant Contact as well. And of course, again, if anybody has questions, always you call the health office. Marty's more than happy to talk to you. He's a good guy.
Okay. The last barrier to breach is Halloween. I know it's still it's a few weeks away, but what's the conversation about Halloween right now in town or at least statewide?
I'm not aware of the conversations at the state level. I know locally it's become sort of a hot button issue. And again, we're sympathetic to the fact that we've had to make a lot of sacrifices this year. People are tired of having to do these things. As an elected official on the Board of Health, my primary concern is keeping people safe. Sometimes they may not like the measures, but all we're doing is try to keep people safe. I love Halloween. It's my favorite holiday. This was probably going to be the last time I could get out to convince my kids to trick or treat. Right now, at least as of our board meeting, we discussed it. The Board of Health is not in charge of whether or not there's trick or treating in town. Apparently, that decision is ultimately made by the Board of Selectmen. We can make a recommendation, which I would defer to Marty. When we met on Monday, there had been no guidance yet, and we were all of the opinion that trick or treating would be okay if we were all cautious about it. Apparently, since then, the CDC has released guidelines strongly recommending against trick or treating. So ultimately, what's going to happen is it's going to be DPH and the governor's office is going to make the decision. And as a public health official, I would just ask people to abide by that. Governor Baker, DPH, elected officials, nobody wants to ruin your holiday. We want to keep people safe. And what are you going to do?
Right. Anything else that you want to touch upon while we have a couple of moments here and folks viewing at home?
One message that I wanted to get across to people, especially as we're going into colder weather and holidays, and I know on Halloween, the other big thing that happens besides trick-or-treating is parties. We really need to continue to avoid gatherings. If you're going to have a party, have an outdoor one, keep it under 25. The thing that I think is important to realize, we all want to go back to normal. We all want restrictions to be lifted. Every time we break the guidelines and there's a cluster, the numbers go up, that pushes reopening that much further away. So as painful and as annoying and sometimes stupid as it may seem, if we all do our best to keep the numbers down, we're going to see that, moving into the next steps of phase 3. If our numbers keep going up, nothing's going to change. So
I want to thank you for your time on the program. We have been speaking with Chris Schultz. He is the chairman of the Abington Board of Health, as we touched upon a couple of different topics, COVID-19, the flu clinic, the limited number of shots, or being the availability to be able to provide those flu shots, and Halloween. If you have any questions in regards to guests to the program, info@abingtoncam.tv. And until next time, have a good day.